Do your feet feel cold even when the rest of your body feels perfectly comfortable? Maybe you are sitting under a blanket, wearing thick socks, and still your toes feel chilly, stiff, or strangely lifeless. Perhaps you notice it most at night when you climb into bed, or first thing in the morning when your feet touch the floor. Some people say their feet feel like ice blocks. Others say their toes stay cold no matter what they do. And many adults over 60 hear the same explanation again and again. It's just poor circulation, or that's just part of aging. But what if cold feet are not something you should brush aside so easily? What if your blood vessels are trying to tell you that something deeper is changing? Hello, I'm Dr. Adrian Keller, and in today's video, we're talking about cold feet and why your blood vessels may be warning you. This is one of those symptoms many seniors dismiss for years, especially if it is not painful at first. But the truth is, feet are often one of the first places where the body reveals circulation changes, nerve irritation, hydration problems, blood sugar stress, and even early warning signs of larger vascular issues. Your feet sit at the far end of the body's delivery system. That means when circulation is not working well, or when nerves are under stress, the feet often complain first. Now let me be clear right from the beginning. Cold feet do not always mean something dangerous. Sometimes the room is cold. Sometimes the body simply runs cooler with age. Sometimes thinner skin, lower activity, or even anxiety can make feet feel colder than they used to. But when cold feet become persistent, unusual, or paired with numbness, tingling, cramping, weakness, or color changes, they deserve much more attention. So let us begin with the most important question. Why do feet become cold more often after 60? To understand that, we need to understand the job of circulation. Blood is the body's delivery system. It carries oxygen, nutrients, warmth, hormones, and all the things your tissues need to stay alive and functional. Your heart pumps that blood outward. But the farther the blood has to travel, the more effort the system needs to stay efficient. The feet are at the edge of that system. They are far from the heart. They rely on healthy blood vessels, enough fluid in the bloodstream, good muscle movement, and healthy nerves to maintain comfort and temperature. Think of your circulation like a city water system. If the pipes are clean, the pressure is strong, and the pumps are working well, water reaches every house. But if the pipes narrow, the pressure drops, or the pump weakens, the houses at the far edge of town are the first to notice. That is exactly how the body works, and your feet are often that far edge. As we age, several things can make circulation less efficient. Blood vessels become less flexible. Activity levels may decline. The calf muscles, which help pump blood back upward, may be used less. The body may be less well hydrated. Blood sugar instability may begin affecting small vessels, and all of that makes the feet more likely to feel cold, heavy, or undersupplied. Now, many people assume that cold feet are purely a blood flow issue, and yes, reduced circulation is one of the biggest causes. But it is not the only cause. Nerves play a role too. Metabolism plays a role. Hydration plays a role. Even footwear and daily habits can shape what your feet feel like. So let us go through the most important possibilities one by one. Cause number 1, reduced circulation. This is the most classic explanation, and for good reason. When blood flow to the feet is reduced, they often feel cold because they are literally getting less warm blood delivered to them. This can happen for many reasons. Blood vessels may narrow. Blood may move more slowly. Arteries may stiffen. The body may be less active overall. And when that happens, the feet are among the first places to feel it. Now, what does reduced circulation feel like? Not always pain. Many people expect poor circulation to announce itself dramatically, but often it begins quietly. The feet feel colder than usual. The toes take longer to warm up. One or both feet may look slightly pale or less pink. The legs may feel tired more quickly. Walking may feel heavier. In some people, there may be cramps in the calves when walking longer distances. This is especially noticeable in older adults who sit for long periods. Sitting reduces muscle pumping. The calves stop helping blood move efficiently. Gravity begins winning. The lower legs become more stagnant. Then, when the body is still for a long time, such as in the evening, the feet become more uncomfortable. That is why movement is so important for circulation. It does not only burn calories, it keeps the system flowing. Cause number 2, nerve changes. Now let us talk about nerves, because this is where many people get confused. Nerves help you sense temperature. If nerves are healthy, they send accurate information to the brain. If nerves are irritated or damaged, the brain may receive confusing messages. That means the feet may feel cold even when they are not truly cold, or they may switch between coldness, tingling, numbness, and burning. This is one reason some seniors say, "My feet feel freezing," while another says, "Mine burn at night," and another says, "They feel numb," like they are not really there. These sensations may all involve the nerves. Think of nerves like electrical wires carrying messages from the feet to the brain. If the wires are healthy, the signal is clean. If the wires are frayed or poorly insulated, the message gets distorted. A normal touch may feel numb. Mild temperature change may feel extreme. Cold may feel painful. Or the feet may alternate between cold and strange tingling. This matters because when cold feet are caused partly by nerve dysfunction, warming the feet from the outside may not fully solve the problem. The true issue may be deeper: blood sugar stress, B12 deficiency, pressure on the nerves, or another cause of nerve irritation. That is why cold feet should never be viewed only as a temperature issue. They are often a message about blood flow, nerve function, or both. Cause number 3, blood sugar instability. This one is much more important than many people realize. High blood sugar and repeated sugar spikes can damage small blood vessels and irritate small nerves over time. That means blood sugar issues can contribute to cold feet in 2 ways at once. They can affect circulation and they can affect sensation. This is why some older adults feel cold feet before they even know they have significant metabolic trouble. The body is already showing the strain in the smallest structures, the tiny vessels and delicate nerves in the feet. Some people think, "I'm not diabetic, so that can't be me." But you do not always need full diabetes for blood sugar instability to begin affecting the body. Prediabetes and insulin resistance can still matter. Repeated spikes still matter. Evening sugar habits still matter. If blood sugar is high often enough, the feet may start sending signals long before a person gets a dramatic diagnosis. And again, because the feet are at the far edge of their delivery system, they often reveal these problems earlier than people expect. Cause number 4, dehydration. This is one of the most overlooked causes of poor circulation symptoms in seniors. Many older adults do not drink enough water during the day. They may not feel thirsty. They may avoid drinking because they do not want to wake at night. They may rely too much on coffee or tea. And over time, the body becomes mildly underhydrated almost every day. Now, what does that do to circulation? If the body lacks enough fluid, blood volume becomes less ideal. The circulation system has less support. Delivery becomes less efficient. That can make hands and feet feel colder, especially in combination with other age-related changes. Think of it like trying to run a fountain when the water level in the reservoir keeps dropping. The pump can still work, but the system is less efficient and less reliable. Hydration is not a glamorous topic, but it matters enormously. It supports blood flow, blood pressure stability, muscle function, kidney function, and tissue comfort. And many seniors underestimate how much better their body can function when hydration is handled properly through the day. Cause number 5, daily habits and external pressure. Not every cold foot comes from inside the body. Sometimes the problem is more practical than people think. Tight shoes can restrict comfort and blood flow. Poorly insulated shoes can leave feet exposed to cold. Long hours sitting in one position can worsen stagnation. Crossing the legs for long periods can reduce flow. Smoking history can damage the blood vessels over time. Lack of walking weakens the body's natural pumping support. Even something as simple as never getting up for long stretches can make symptoms worse. This is why cold feet are often a lifestyle and biology combination. The body may already be more vulnerable, and then daily habits quietly make the problem bigger. Now let us talk about warning signs that mean cold feet should be taken more seriously. If your feet feel cold but also numb, that matters. If the skin changes color, pale, bluish, or unusually red, that matters. If wounds heal slowly, that matters. If walking causes cramps in the calves or feet, that matters. If one foot is much colder than the other, that matters. If balance is changing, that matters. If cold feet are paired with tingling, burning, or weakness, that matters even more. These are all clues that the issue may not be simple. And the body usually does not send one clue alone. It tends to send clusters of clues. Coldness plus numbness. Coldness plus cramps. Coldness plus slow healing. Coldness plus fatigue in the legs. That is the kind of pattern you want to notice. Now let us talk about what actually helps, because this is where many people feel stuck. The first thing that helps is movement. This may sound almost too simple, but it is one of the most powerful circulation tools you have. Every time your calf muscles contract, they help push blood upward. That means walking is not just exercise. It is circulation support. Gentle movement is one of the best ways to tell the body, keep delivering. This is especially important if you spend long periods sitting. Sitting is one of the worst silent habits for circulation. When you sit still too long, the calf pump is quiet, blood flow slows, and the feet often feel colder and stiffer. That is why even short walking breaks matter so much. And if walking outside is difficult, indoor movement still counts. Standing up more often counts. Marching lightly in place counts. Ankle circles count. Calf raises while holding onto a chair count. The body responds to movement, not perfection. The second thing that helps is better hydration. Again, I know hydration sounds basic, but the basics often matter most. Better hydration improves blood volume and supports more efficient delivery through the system. This does not mean flooding yourself with water late at night. It means building steadier hydration across the day. Many seniors wait until they feel thirsty, but thirst becomes less reliable with age. So the body may already be undersupplied by the time thirst appears. A smarter strategy is to drink regularly through the morning and afternoon, rather than relying only on thirst signals. The third thing that helps is protecting blood sugar. If blood sugar instability is part of the problem, no amount of socks and blankets will fully solve it. The body needs a better internal environment. That means fewer sugar spikes, better meal balance, and often more movement after meals. Stable blood sugar helps protect both the vessels and the nerves that shape what your feet feel like. The fourth thing that helps is supporting the nerves. If the feet are cold because sensation is being distorted by nerve stress, then it becomes important to think about the common reasons nerves become irritated after 60. B12 matters, blood sugar matters, pressure and footwear matter, movement matters. In some people, even certain medications may play a role. This is why numb cold feet deserve more attention than simply cold feet. Once sensation changes, the nervous system becomes part of the picture. The fifth thing that helps is footwear. Warm feet need more than warmth. They need comfort without pressure. Tight socks or tight shoes can backfire. A shoe that compresses the foot too much may make circulation and nerve comfort worse. Good footwear should protect, cushion, and allow the foot to feel secure without squeezing it. This matters particularly in winter, on hard floors, and during long periods of standing. The sixth thing that helps is paying attention to progression. This is one of the most important habits in all of senior health. Notice what is changing. Are the feet colder than 6 months ago? Is walking becoming less comfortable? Is numbness increasing? Are there color changes? Do symptoms improve with walking or get worse? Is one foot different from the other? Are you also noticing weak legs, poor balance, or slow healing? These patterns matter because they tell you whether this is a simple comfort issue or whether it may be something that deserves medical evaluation. Now, I want to say something very important about independence. Cold feet may sound like a small problem to some people, but in senior health, small problems often become bigger life problems if ignored. Cold feet can reduce confidence. They may signal circulation or nerve trouble that affects balance. They may make walking less comfortable. They may be the first whisper before the body begins speaking more loudly. And that is why I never like it when seniors are told, "It's nothing, just wear thicker socks," without asking deeper questions. Sometimes thicker socks are fine. Sometimes it really is that simple. But sometimes the blood vessels are asking for attention. Sometimes the nerves are asking for support. Sometimes the feet are showing you the earliest signs of a larger vascular or metabolic issue. That is why the feet deserve respect. Now let us build a practical routine for someone dealing with cold feet. Start with better hydration during the day. Move more often, even if the movement is gentle. Avoid sitting too long without standing. Use supportive shoes and avoid tight pressure. Pay attention to blood sugar habits, especially if there are other symptoms like tingling or numbness. Notice changes in skin color, healing, or balance. And if symptoms are persistent, worsening, or paired with numbness, pain, or cramping, bring those details to a healthcare professional. That is how you move from passive discomfort to active protection. I also want to talk briefly about emotion because cold feet can make people feel older than they are. It can make them feel fragile. It can make them feel like their body is shutting down. I understand that fear, but I want to reassure you. Symptoms are not always final judgments. Often they are early information. And information gives you a chance to act. If your feet are cold because you are more inactive, you can improve movement. If they are cold because hydration is poor, you can improve that. If blood sugar is part of it, you can stabilize that. If the issue is nerve-related, you can investigate that. If circulation needs help, earlier attention matters. In other words, cold feet are not always a sentence. Sometimes they are an invitation to pay attention while there is still a lot you can do. Before we finish, I would love to hear from you. Tell me your age and where you're watching from today. And tell me this, do your feet feel cold all the time or only at certain times of day? Do they also feel numb, tingly, burning, or weak? Do they improve with walking or stay cold no matter what? I read your comments, and they help me understand exactly what this community is experiencing. And let me leave you with this. Your feet are often the first place where the body reveals hidden stress. They tell the truth about circulation. They tell the truth about nerve health. They tell the truth about hydration and blood sugar. And when they keep feeling cold, that truth deserves your attention. Do not panic. But do not ignore it, because after 60, the body often whispers before it shouts. I'm Dr. Adrian Keller, and it has been a pleasure spending this time with you today. Protect your circulation, support your nerves, and keep listening carefully to what your body is trying to tell you. Small signs noticed early can protect comfort, mobility, and independence for years to come. I look forward to our next conversation. Until then, take good care of yourself, keep those feet moving, and stay warm in the ways that matter most.